Thank you, Chief. If I could, I want to begin just by reiterating what we've heard time and time again. Maintain social distancing. I was reading an article, and it was talking about the success that they have had in South Korea with stemming the spread of the virus, and primarily the reversal of the high incidences of infection in South Korea has been attributed to people forcibly maintaining social distancing. And I want to say the governor has entered an executive order, and now that is actually the law of the state, so we don't have any option. We need to follow those directives. I want to say just briefly, we had a conference call this morning. Governor Kemp participated in the call. We had good news. I've made notes. The state will be providing resources to us here in Southwest Georgia. Hopefully there'll be nurses who will be coming to help at Phoebe, and also beds will be provided, I believe, that will increase the capacity at Phoebe North. There are CDC teams here working, and I guess the medical professionals can tell you basically what they are doing. Governor Kemp mentioned the National Guard, and I don't know, people get somewhat hysterical when they hear the National Guard's coming in. Governor Kemp explained to the individuals on the conference call, which included elected officials from many surrounding counties and some from throughout other areas in Southwest Georgia, that the National Guard is coming to assist local authorities, particularly in setting up facilities for isolation and other things like that. And fourthly, the governor said the state is attempting to locate and provide ventilators, respirators, and personal protective equipment. On this conference call that we have mentioned in the last few days, it was organized, the governor emphasized to elected officials in contiguous counties and around Southwest Georgia that this is a problem that cannot be addressed in isolation here in Albany and in Dougherty County. We know that Lee County has already implemented an ordinance, but hopefully we're going to see that surrounding counties are going to take some action. And I do note, I think this executive order is going to essentially prohibit worship services if more than 10 people congregate and can't be within 6 feet of each other. So we have the executive order that's in place that's going to apply to these counties, but hopefully we'll see surrounding counties take some of the initiative, and so that measures are implemented to protect their citizens. And as we all recognize this morning, implementing precautions not only protect our citizens, they protect people who come in contact with our citizens, which are people throughout Southwest Georgia, and the converse of that is true. If measures are implemented in surrounding counties, then the citizens of those counties will be protected, and likewise the citizens of Dougherty County will be protected when they come into Dougherty County to work and shop. Thank you. Please continue to maintain social distancing and wash your hands thoroughly, repeatedly with soap and water throughout the day. I know you're tired of hearing that, but when we get through this, nobody will come to this podium and need to say it anymore. Thank you.
Thank you, Mr. Mayor. I'd like to ask Chairman Christopher Cohilas to come up for some comments.
Thank you, Chief. Thank you, Mayor. A reminder, the shelter-in-place order remains. This remains for your safety as well as for the safety of all of our citizens. The COVID virus is present and in this community in a very profound way. We know that it has also infiltrated at least one of our nursing homes. Just understand that Mayor Dura and myself have been working around the clock requesting each and every resource that we can possibly have. To date, as of today, we now actually have an operational self-isolation quarantine facility that is at one of the hotels that is here in Albany, Dougherty County. Those patients that are leaving Phoebe, which are suspected of having the COVID virus, or who have been exposed to the virus but who do not have an appropriate place where they can isolate themselves at home, this is a resource that will be made available to them. It is safe, it is secure, it is actually guarded by National Guardsmen. They will be fed and protected and allowed to self-isolate at that hotel. We are currently working through the process with the Department of Public Health as well as with Phoebe staff so that we can make sure that there is a transitional process where those patients who are transitioning through Phoebe can access this resource. We are also very thankful to the governor for making this resource available to us, as well as for the 2 EPI teams that we receive from the Department of Public Health and from the CDC. Right now, we have a significant problem in Daugherty County. We have taken swift and decisive action in order to address it, but we continue to need the help of our citizens in making sure that we are exercising best social practices, social distancing. If you're not in a such essential business, I understand that it is hard to go without during this time. I understand it. We get it. But right now, these measures, though they appear drastic, they are for everyone's safety. We currently see each day as we test approximately 100 different citizens at our different sites that this is a problem that we're going to have to deal with, and we need to be able to flatten the curve. I'm proud that Mayor Dura and I were able to launch efforts this morning, as we announced we would last week, to host a regional phone conference with our neighboring and surrounding counties and city leaders so that we could actually share the information on how it proliferated in Albany and Daugherty County, the measures that we have taken as a community in order to address and arrest its development. It was well received, and also very thankful for Governor Kemp accepting my invitation to be a part of that phone conference and also be able to explain some of the many questions that exist regarding his order. His order applies to the entire state and restricts a lot of activity. Our order stands in complete congruence with his order, but also provides additional restrictions. We have made sure that we have had a communication strategy to be able to proliferate this information out to the public so that people can get answers to their questions on whether or not their businesses can operate and what activities they can or cannot do. Again, please do not congregate unnecessarily. I also am pleased to have Chairman Mathis here from Lee County, and I want to announce that this has been a very joint process. We are very thankful to our neighbors of the North. Many of their citizens work in our community each and every day. Their citizens are our citizens and vice versa. We appreciate Chairman Mathis's leadership and the fact that they have exercised discretion and swift decisions in order to make sure that our neighboring community to the north is likewise safe as well. They are dealing with the same problems that we are dealing with, and we certainly want to make sure that every resource is available to them, including being able to make public announcements here today, and I welcome Chairman Mathis. I also want to remind everyone, one nuance or one activity that we have noticed is our convenience stores. We recognize that they provide services and goods to people in the community. We don't need to be in convenience stores in large amounts. I would caution my convenience store owners, please make sure that the people that are visiting your store exercise social distancing, meaning stay 6 feet apart. Make sure that people are not congregating unnecessarily, that people aren't lining up in a lottery line, that make sure that people are conducting their business and moving swiftly through your store. I say this for this reason. If we cannot get a handle on this, we will be forced to take more restrictive measures. And understand this, I'm a business owner. I don't like any restrictions on business whatsoever, and the fact that we're having to do this right now pains me extremely. But we will have to do it if we're not able to arrest the growth of this virus in our community. I also want to remind our nursing homes and long-term care facilities in our community to work with the Department of Public Health. We have teams on the ground that we have specifically requested to come and address the matters that face our most vulnerable elderly and sick folks that are here in our community. We know that the coronavirus is particularly lethal to members of the vulnerable medical community, and we want to make sure that these facilities are safe. Listen to the Department of Public Health and the directions that have been given to you by them, as well as from the CDC. Your cooperation is not only encouraged, it is required. And if it is not provided, additional action will be taken. And we know that you are all good partners, but we're in a critical position here and need to continue to emphasize extraordinary compliance and vigilance as we move through this. We have to be disciplined people, disciplined citizens as we move through this, and we need to be leaders in the region. I thank you all.
Thank you, Mr. Chairman. Again, I'd like to reiterate we are very pleased to have with us today Lee County Chairman Billy Mathis, and we'd like to ask Chairman Mathis to come up for some remarks. Mr. Chairman.
Thank you all for having us. Thank you, Mayor Dura, and thank you, Chairman Kohelas. We in Lee County don't often get the free press that you guys get, and we think it's important for us to point out that all three governments have worked very well together up to this point. I've been in almost constant contact with Mayor Dura and with members of the Daugherty County Commission. There has been some confusion among the residents about the differences in the ordinances and orders between Lee County and Daugherty County. There really isn't all that much difference. I'm not going to rehash all the things that the mayor said or that Chairman Kohelas said about all the things that we need to do. But if you will simply follow the governor's orders and the directives that have been put out on both of our websites, it would be appreciated by all of us. This morning we gave a brief press conference, and I wanted to again stress that one of the problems that we've had in Lee County is churches having large congregations. We would urge the churches and the pastors of those churches to talk to their congregations, abide by the rules for a couple of more weeks, and lead by example, if you will. We need to curb these large gatherings as quickly as possible. Again, I'm not going to take a lot of time. We appreciate the fact that our three governments are working together. All of the things that we're doing are very similar about the restrictions. We don't like the restrictions, but it's necessary. But I would at this point like to point out a few things that we're doing in Lee County. One difference is, just as a point of clarification, we now have a curfew from 10 p.m. to 6 a.m. All of our kids are out of school, and that gives the sheriff a little more leeway in making sure the kids stay home. We'd appreciate folks staying in at night if they will. Another thing that I wanted to mention in Lee County is there seems to be a great need for our children, some of our children, since school's out, to have lunches and breakfast. The Board of Education is providing lunches on a daily basis for those children in need. Our Lee County Family Connections is also providing food through the food banks to families in need. And you can call our main number, 759-6000, to get that information if you're in need of those particular things. Again, if there are any questions, it's really, really hard. I know the mayor and Chairman Kohelas and I talked about it earlier. It's hard for the three of us to answer every single text and email, even though we try very hard to do that. So this is important, that people know that we're all together and that all of the things that we're trying to do are very, very similar. So if you see their set of rules, follow them. If you see our set of rules, follow them. But whatever you do, I saw somebody say earlier, those guys are just going to get up there and say, wash your hands and social distance. I put that on my Facebook page and I said, wash your hands, social distance, repeat, repeat, repeat. We can't stress that enough that we need to do that. One other thing, again, please. Sunday, I sat at my bar, in my kitchen, in my pajamas with a bowl of cereal, and I watched a church service at Porterfield. If you will, for a couple of more weeks, let's follow those rules about going to church, or in this respect, really not going to church. My wife said it best. She said, God will love you even if you don't go to church for a couple of weeks. My father-in-law is a 91-year-old retired minister. Those are the people's lives we're trying to save. Stay at home, worship at home, follow the rules. We will continue as the three governments to work together as best we can to get through this. Thank you so much.
And thank you, Chairman Mathis. I'd like to get our Phoebe update. We have the Chief Medical Officer of Phoebe Putney Memorial Hospital, Dr. Stephen Kitchen. Dr. Kitchen.
Thank you, Chief. And I'll begin or preface my comments by saying what I have to report to you today, I think certainly goes in tandem with everything that you've heard so far in terms of effective strategies that we can employ to curb the transmission of COVID-19 virus in our community, because I will tell you, to date, we have not flattened that curve. And by what I mean by that is in terms of the number of cases of positive COVID-19, as well as those tests that are pending, or we have what we call persons or patients under investigation, those numbers continue to rise at this point. So effective this morning across our health system, and that includes Phoebe Putney in Albany, Phoebe Sumter in Americus, and Phoebe Worth in Sylvester, we have a total of 150 patients who have tested positive for COVID-19. That represents an increase of 25 since yesterday. Of those patients, 32 remain in the hospital. 31 of those are at Phoebe Putney in Albany, one at Phoebe Sumter in Americus, and 107 patients are at home. Regrettably, we have had 3 additional deaths since yesterday. So that number now has risen from 8 to 11 deaths. If you take the number of patients we have at Phoebe Putney in Albany who either have a confirmed positive test or whose test results are pending, we currently have roughly 120 patients in the hospital at this time. And so we continue to see those numbers increase at this point. I spoke on Sunday that because all 3 of our intensive care units at Phoebe Putney in Albany were filled with COVID-19 patients, we opened up a 4th makeshift intensive care unit in what typically is what we call our post-anesthesia care unit right off of the operating room. That ICU has a bed capacity of 10. That unit is filled as well. Now that unit is filled with non-COVID-19 patients, but the point I'm trying to drive home is that we continue to see an increase in the number of COVID-19 patients in our community, and we also see an increase in the number of patients with COVID-19 who are critically ill and require ICU services at this point. So I will tell you, we're quickly approaching the point of maximum capacity with regards to the number of beds that we have that can be allocated for COVID-19 patients on general medical floors, and more importantly, the number of COVID-19 patients who need an ICU bed and critical care services at this point. So I think you've already heard references that the mayor, Chairman Cohilas, Chairman Mathis have been in close conversations with the governor and other state agencies at this point, and I will tell you, we're reaching the point where we need a pop-off valve. We need a relief valve. And so earlier this morning, I can tell you we were in conversations with officials from the state about the possibility of standing up a certain number of ICU beds and a certain number of general medical beds at Phoebe North to, again, be able to meet the needs of our community in caring for patients with COVID-19. This is a significant undertaking, and it cannot be done if we don't work in tandem with our officials at the state, and we'll need assistance in trying to staff that, because I can tell you, trying to find additional nurses at this point, that's a precious commodity and a precious resource at this point. I will tell you, and again, I think this speaks to the need in our community and the fact that the pattern of transmission in our community is certainly from the level of the state. We have a number of cases that are comparable to what is seen in the metro Atlanta area at this point. I will tell you, I've been in conversations with Commissioner Toomey this morning. I had a long conversation with Senator Ben Watson, who's intimately involved with the governor's task force. And I have been very frank and very candid in terms of what our situation down here and what our needs are. And I think we have I think we certainly have a listening ear, and I think in terms of their advocacy on our part, that I think it's very feasible that we're going to see that pop-off valve or relief valve that I talked about in terms of having additional resources at this point. I think another fact that I think underscores what we're seeing in our community, we had 20 additional ventilators that were delivered to Phoebe Putney yesterday, and again, that is directly in response to the need to be providing additional ICU care in our community at this point. And you know, I think sometimes sharing a personal story, or what I would refer to as a clinical vignette, I think can convey what we're seeing right now. So about 11:30 last night, I had 2 calls from the hospitalists who are on our staff, and they had a situation where they were caring for patients on one of our COVID-19 floors, and they had several patients for whom their condition was deteriorating at that point, and they really needed to be transferred into the ICU. We had actually 2 beds at that point, but we had 5 patients who needed a bed. So I will tell you, I came in, and again, what I witnessed was professionals at work. They were calmly going about their business and making sure they were putting patient needs first. So we marshaled all of our resources, and you know what we did, we were able to free up some beds, move a couple patients out of the ICU, and meet the patient care needs at that point. But that's a little indication of what we're facing on a day-to-day basis at this point. So I would like to applaud the efforts that have been taken by Dougherty County, Lee County. I think the shelter is something that we desperately need at this point, and we look forward to working in cooperation and in tandem with our local, state, and federal agencies. So thank you.
Thank you, Dr. Kitchen. Next, we'll have an update from our public health. We have the director of the Southwest Georgia Health District, Dr. Charles Ruiz. Dr. Ruiz.
So let me start with the most discouraging news and give you an update on lives that we've lost. And I'm confident that the coroner will come forward soon and he will address the totals for Dougherty County. And as you recall, I'm the health director for the 14-county health district in southwest Georgia. And so I want to report on those 13 counties outside of Dougherty for the moment. As of this morning, when we consider the resident county of the individuals, still have been 2 deaths from Terrell County. We have 1 from Early, 1 from Mitchell, 1 from Baker, and a total of 3 now from Lee. So that's 8 people who have passed away in counties outside of Dougherty as of this morning. I want to talk about a situation that I know has occurred repeatedly over the past couple of weeks. There have been times when the emergency medical service has been summoned and they will go out to help someone in distress, only to find out much later that this is a person who has been diagnosed already with COVID-19. And I submit to you that's a dangerous situation, and it would really be great if, when people need help, certainly call for EMS, but if the patient is known to be a COVID-19 patient, please share that information with the healthcare providers. It would help a great deal. The governor has extended authority to the Department of Public Health that we don't normally have. And the Commissioner of Public Health for the state of Georgia, Dr. Kathleen Toomey, has signed an administrative order outlining the importance of following recommendations that most people have already heard several times, such as social distancing and adhering to quarantine and isolation and so forth. But there's a new part in that administrative order, and it deals with just this issue of not sharing information. So there's officially an order now that says that if you know that you are a COVID-19 positive patient, it is your obligation to share that information with those with whom you come in contact. So you could argue, I think, that it's unethical not to share that information with those who are caring for you, and now I think you could argue that it's illegal not to do so. It is concerning when COVID-19 infections get into long-term care facilities, and it's sad to say that we've had some of that already in Dougherty County. And we're happy to say that we do have 2 professionals from the CDC who are in town this week, and starting Sunday, we began meeting with representatives from the affected long-term care facilities. We continued that again yesterday, and that's going on today also. Something else that's happening this afternoon is our epidemiology team, along with the 2 individuals from the CDC, are conducting a conference call, and every long-term care facility, every nursing home facility has been invited to participate in that call. And then tomorrow, there will be a similar call for assisted living and personal care homes. So we've got these professionals here looking at the evidence that we have, the statistics, and looking at practices, and helping us to make sure that we're doing everything that we can in long-term care facilities to keep the workers and the residents and the community safe. I'd like to say again that the CDC is an excellent source for guidance. Just about any topic that you can think of related to COVID-19, they have got an article on it. And that's true as well when it comes to long-term care facilities. A great article on how management and staff for long-term care facilities can make sure that they're practicing good CDC guidance. I'd like to also say a word about, to follow up on what Dr. Kitchen said about the stress applied to the hospital. Bear in mind that anytime that you use the hospital now, you are consuming precious resources, whether it be personal protection equipment or nursing time or doctor time. In some cases, that cannot be avoided. We can't always pick and choose some of the medical events that sneak up on us. But I used to be an emergency room physician, and I know that a lot of things that come through the emergency room are a result of choices that we make. So a lot of people are not working now. They're home from work, they're out of school, and certainly you've got to find things to occupy your time. So what I'd like to suggest is when you make a choice, try to choose something that's not so dangerous. This is not a good time to be racing motorcycles and automobiles or climbing trees and that sort of thing. If you wind up in the emergency room, if you need the emergency room, it's there. But if you go there, you're going to consume precious resources. One last thing I want to talk about is those surrounding counties that someone else mentioned earlier. Out of the 14 county health districts, certainly Daugherty County has been hit harder than any other. But I want to say that this could possibly be the calm before the storm throughout the rest of our district. I hope not. I hope that the other counties are learning from what's going on here in Daugherty County. I hope that the other counties are practicing social distancing and practicing good hygiene. The health departments and I have been pushing that message throughout the district, but let's take what we've learned here and apply it throughout the rest of the health district. Let's work together to slow this virus down. Thank you very much.
Thank you, Dr. Ruiz. We will have time for a few questions today. If you have any questions of any of our speakers today. Okay, with that, seeing no questions, we encourage you to, if you have questions about the ordinances that have been put in place, whether or not businesses should be open or closed, you can call, of course, 302-1900. That's the Emergency Operations Center. We will either have that information for you or be able to route you in the direction of the resources that you need. So 302-1900. Thank you so much for being here, and we will see you tomorrow at 1 p.m.